Welcome to the world of perioperative nephrology, and welcome to the point when we discover that cell cycle arrest biomarkers offer us hope. This piece presented by Professor Monty Mythen and Dr. Joff Lacey, featuring guests John A. Kellum, a tenured professor in critical care medicine from the University of Pittsburgh, and Dr. Tim Miller from Duke University Medical Center, discussing perioperative nephrology and how cell cycle arrest biomarkers can offer practitioners more than a little bit of a ray of hope. Have a listen to this.
Top Bed Talk. There is some hope from some novel biomarkers.
There is indeed. And these markers, what we call cell cycle arrest biomarkers, are markers of the kidney's own effort, and I'll try to explain this quickly, its own effort to protect itself, because epithelial cells in the kidney, renal tubular epithelial cells, are very sensitive to environmental stress, like the epithelial cells in your body. And in that setting, the kidney protects itself when it thinks that there is potential harm. And we're finding that signal emerging into the urine, and then we can measure that signal. And it tells us something we don't otherwise know, because remember, kidney injury is otherwise silent. You don't have pain with kidney injury, but these biomarkers tell us that the kidney is under stress. And it doesn't always mean just because the kidney is under stress, something bad is going to happen. But if it's under stress, it should alert the clinicians that, wait a minute, maybe there's something, maybe this medication's a problem, maybe there's undiagnosed sepsis, maybe there is a perfusion pressure issue, maybe there's something we can do.
And these are now FDA approved, they're commonly available, they're being used clinically?
Correct.
Okay, and throw me a
tissue
name.
Inhibitor of metalloproteases 2 and insulin-like growth factor binding protein 7. If you can't remember that, Nephrocheck is the trade name.
Nephrocheck. Much more catchy, I think.
Yeah, I think so too.
Nephrocheck. Okay.
And can I just ask, is that being done preoperatively for a risk stratification process, or only after an insult that you do?
These markers detect acute stress. So if I stress the kidney and the markers go up, it means something. Prior to having any stress, they're not markers of frailty, for example.
Gotcha.
And I was very interested, John, you mentioned one study where they tested these markers and then they intervened and they were able to reduce the incidence of AKI. Can you just mention that in a couple of minutes?
Yes, Alex Arbach's paper in Intensive Care Medicine. I invite you all to read that. It's an excellent example of how we can use these markers.
Top Bed Talk.
This piece was recorded during our coverage of EBPOM 2017. Why not check out our back catalogue? We have a fascinating array of incredible conversations, all of them about perioperative medicine in the Top Med Talk style.